Hello dear students, welcome back to Top Lesson for You. Dear students, as we are discussing about the introduction of anatomy, so we have recorded already about 4 or 5 lectures about the definition of anatomy. Then we recorded about the history of anatomy, and then we recorded about some branches of anatomy or some sub-disciplines of anatomy. I have already recorded, right? Now the term is that we should know about some important anatomical terms, right? So we are discussing about the anatomical terms. So there are many terms. So we divide them in our books. They are divided as the terms related to body movements and the terms related to body positions, and some others also we will discuss in the coming next lectures, right? So in this lecture I'm discussing about the terms related to body position, right? Let's discuss. So while discussing anatomical terms, first of all we discuss about terms related to body position. Right. So in simple English, if we talk not in anatomical language, right? If we talk in English, so what will we say? Look carefully. Look, friends, what I'm going to tell you, I want to put in your mind a basic concept about the terms related to body position. Look carefully. You can say that, or let me take this marker also. Look, in simple English, we say that the blue marker is on the right side of the green marker, and the red marker is on the left side of the green marker, and the green marker is in the middle, is in between the red and blue marker, right? We say, in English we say like this, and we say that my left hand is above my right hand. This is my right hand, this is my left hand, right? So my left hand is above my right hand. So we say above. What this above is called in anatomy, right? And we say that my right hand is below my left hand. So what do we call this below in anatomical language, right? As the anatomical language is derived from Greek and Latin languages, right? That's why it's a very little bit difficult to learn, but no problem. We will learn them inshallah. Look, my left hand is above my right hand, and my right hand is below my left hand. So what do we call this above and below in the anatomical terms, right? You are in front of me, in front. Amn't I? Yeah, I am. Or you can say, I am in front of you. So in front, what do we call this in front in anatomical language, right? And this whiteboard, you can see the whiteboard is behind me, right? So what do we call this behind in anatomy, right? If there is the chair is in the right side of me, right? And this, my friend is standing on the left side of me. So what do we call this left side, right side, behind, in front, above, below? These are the simple English words, but in case of anatomy, we call them something else. So we should have a clear concept of these anatomical terms, the basic terms, right? So the first pair that I am going to write is, look carefully, let's write the first pair. I'm writing them in pairs because while we write them in pairs, they will be very easy in understanding. So the first pair is superior and inferior. Clear, friends? So superior has been drawn from super, and super means above, right? So superior means above, okay? And inferior is the opposite of superior, so obviously inferior will means below, Clear, friends? How do we use these words? How do we use these words? Look carefully. My eyes are superior to my mouth, as my eyes are above my oral cavity or mouth, right? So my eyes are superior to my mouth and my mouth is inferior to my eyes, right? My head is superior to my shoulders. My head is superior to my shoulder and my shoulders are inferior to my head. Right? So when we are discussing about the parts of the body, we say that abdominal cavity is inferior to thoracic cavity. Inferior means below. So abdominal cavity is below the thoracic cavity. So we don't say below, we say inferior to thoracic cavity. And the thoracic cavity is superior to abdominal cavity. Right? So superior, inferior, I hope you clear these terms, right? So superior means above, inferior means below. Clear, friends? Now we can also use these terms as the cranial and coudal. Right? Both of them are same as them. Right? Look, cranial. I will write it again here. Cranial means above. Or if you want to write it super clearly, you should write towards head. Right? And if you want to write coudal, so coudal means below. Below. Or you can say towards cauda. And what is cauda? I will tell you right now. Look carefully, friends. Why do we say that this superior is also known as cranial and this cranial is also known as superior? Why? Because cranial means towards the head. Now look, when we are coming from inferiorly towards the superior parts, so this is the head and there is nothing else above the head, right? This is my chest. Then there is my neck, then there is my head, and above my head there is nothing. So head is the superior most part of the body, right? Head is the superior most part of the body. That's why we say that the cranial means towards the head. So it means that we are pointing to the upper part, and upper means above and above means superior, right? So cranial means above or towards the head, and caudal means below or towards the cauda. Look carefully, friends. This part is called the caudal part, right? This is called cauda. So cauda means, as this cauda is below the head, so it means that away from head, downward, or towards the cauda, right? So we simply say that cauda means below. He is not happy because it's very cool and he is not wearing anything, right? So the third pair is, first was superior, inferior, then cranial, caudal. Then the third pair that we have here is the anterior, posterior. Anterior and posterior. What is meant by anterior and posterior? Look, friends, anterior means in front, and posterior means behind. Now look carefully what I'm going to say. The anterior, you are anterior to me, you are in front of me, and the whiteboard is posterior to me, the whiteboard is behind me. Right? So behind, in English we say behind, but in anatomy we don't say behind, we say posterior. So posterior means behind, anterior means in front, right? My nose is anterior. And my occipital bone is posterior. Isn't it so simple? My backbone is posteriorly, but my sternum is anterior. Okay, friends. Then we also use, for these words, we also use the ventral and dorsal, right? The same thing is also, these are the same thing. So ventral means in front and dorsal means behind or posterior, behind, right? So look carefully, my vertebral column is dorsally and my sternum is ventrally, right? The sternum is anteriorly, okay, and the vertebral column is posteriorly or dorsally. Clear? So dorsal and posterior are the same. Rather, there is difference in pronunciation and spellings, but both of them have the same meaning: anterior or ventral, posterior or dorsal, right? So next term regarding the body position is the medial and lateral. Look, number 5, medial, and there is lateral. What does it mean? Medial means mid means midline. Look carefully. This is the middle line of our body, right? The mid-sagittal section. Let me draw a diagram here. This is a person, right? A very simple person wearing a very long coat, right? So this is the midline of the body. Clear, friends? This is the mid-sagittal plane. Now look, when you are coming towards the midline, right? When you are coming towards the midline, this is called medial, right? So we say towards, medial means towards midline. This is the midline, right? Medial means towards the midline or towards the middle line of the body, right? So look carefully. If I'm holding my both hands like this, right? And I'm bringing my hands like this towards each other, so I am coming, both of my hands are coming towards the midline of my body, so my hands are moving medially. My hands are moving medially, right? So medial means towards the midline, right? And lateral means when you are going away from midline, this is called laterally, right? This is called lateral. So lateral means away from midline. This is called lateral, right, friends? So why do we use these words? Look carefully. Look, my arm is lateral to my sternum, isn't it? Sternum is lying in the midline, so my arm is, look, I am pointing away from the midline, right? So that's why we say my arm is lateral to my sternum. And then if you want to say about ribs and arm, look, this is your arm and these are your ribs. So your ribs are medial to your arm, right? Look, I'm pointing towards the midline. Okay, so my arm is lateral, away from midline, lateral to my sternum or my ribs, and my ribs are medial to my arm, isn't it? Now look, my ribs are lateral to my sternum, and my sternum is medial to my ribs. It's so simple, friends. Okay, this was another pair that we completed, medial and lateral. Then there is another pair, and that pair is called the proximal and distal, number 6.